Hello, Princeton Integrative Health Community. Um, just wanted to say that welcome to all of you. So excited that everyone is here. I am had some technical difficulties getting going, so sorry I'm a few minutes late. Not great at working with this new Facebook Live editor that they have, but yeah, guess we'll just have to work through that. Have to get better at it. So, um, I've been, guess as we go through this, and I've been doing more Facebook Lives now, I tend to, I've been thinking about why do I do this? And I've really come to the realization, I guess I've realized it all along, but I guess I never really say it out loud. I really enjoy educating people and guiding people. I really enjoy uh, when people ask questions, and I can use that to clarify issues for people. I enjoy being a guide in the healthcare space for people to help make sense of what's going on. Um, you know, I am not really beholden to any groups. I don't have any irons in the fire that I have to worry about with people. So just trying to give you my best unbiased advice from a guy who's been a physician for over 35 years and has seen a lot of things going on. So that enough said. Hello, Krista. Thanks for being here. Um, I wanted to talk about what's being called the Five Phases of Coronavirus by Gerald Parker at Texas A&M University, where he directs the Bush School Biosecurity and Pandemic Public Policy Program. He did an article with the Houston Chronicle. Also in this, I used scientificamerican.com. They spoke with Johns Hopkins health security expert Tom Inglesby, and Forrester Research published an article in Forbes magazine on April 9th. So those are my sources, and you know, um, I've been interested in this topic personally. What's it going to look like going into the future, and when can we reopen? Uh, you know, cases are now starting to decline in New York. New Jersey appears to be flattening the curve. So, it feels like sometime in the next, weeks, maybe a month, that we'll see some phased reopening. But we'll talk about that a little more as we get into the article. Um, so, the five phases of coronavirus, without further ado. Um, so, phase one is containment. That started at the end of January when travel restrictions and travel bans were placed on China. That was an attempt to slow the virus coming into the country. I think we all remember the cruise ship that was held off the coast of California because we didn't want to have um, those 15 extra cases coming in, or however many cases there were on the cruise ship. Uh, you know, but cases inevitably got in. Maybe they didn't come from China, but they came from Europe, and we weren't really didn't have travel restrictions at that point on Europe. So the cases got in by late February. It was apparent that not only were cases coming in, but we're having community spread here in the United States. This overwhelmed the capacity of the public health system to do individual case by case containment, where they would, identify a case and then look for the contacts. There was not enough resources to do that anymore once we got into the community spread. This is when we transitioned from phase one, containment to phase two mitigation. What do we mean by mitigation? So mitigation is the phase we are in currently. The goal of mitigation is to slow the spread of the virus within our community. So it's already spreading. We want to mitigate or reduce the transmission so the cases stay down. Why do we want to do this? Well, number one, we don't want to get sick. But number two, we want to prevent our hospitals from being overwhelmed by the critically ill from COVID. As I mentioned in a previous Facebook Live, once your hospital system gets overwhelmed, it seems like mortality spikes at that point because there aren't enough ventilators, there aren't enough healthcare workers, people are in the halls. I mean, we haven't had to resort to that. I think in this country because of the social distancing measures that we've put into place, the social isolation. But I mean, if you just want an example of that, look at what happened in Italy with the reports coming out of there of hospital workers being overwhelmed and there not being enough ventilators and them having to triage who was going to get a ventilator or not, and therefore who was going to live or die. I mean, once that starts to happen, the death rate seems to spike up to over 5 to 7%. So we don't want that. Current death rates, as far as we can tell, are probably closer to the 0.6 to 1.0% if there's no overwhelming of the health system. And I'm thinking that the 1% may even be a little bit high, that once we get real widespread testing, we'll see that the death rate is probably closer to the 0.6% mark that they have in South Korea. But seasonal flu has about a 0.1%, so even 0.6% is certainly considered high by that standard. So think that doing our social distancing and our hygiene measures is a good idea for right now, and continuing that as we get into the next phase. Also, we'll talk about that. So again, the purpose of the aggressive, what they're calling the aggressive social distancing measures, closing schools, distance learning for universities, businesses doing a lot more business online. Avoiding, large gathering events and only keeping essential businesses open. That's to mitigate so the healthcare system doesn't get overwhelmed. Mitigation can also be applied to economics factors so that the unemployment insurance and financial relief packages are examples of financial mitigations from the impacts from this. I don't know about you, but I certainly feel like I am ready at any point to exit this phase as soon as it's safe. We all want to get back to our jobs, and how can we safely reopen? So that's moving into the next phase. As I mentioned, it looks like cases are decreasing in New York, so that's a good sign. Curves flattening in New Jersey and even in Pennsylvania. So as the cases start to decrease, and I think some of the experts are thinking once we see a decline in cases for about 2 weeks, that they feel that we'll be able to start to reopen in a phased manner. There's a consortium of 7 Northeast states that going to coordinate their reopening to make it, to put that in a better place so that, there's more uniformity. There's certainly no national standard right now, and probably be difficult to implement that with different states being at different stages. But if we can get these blocks of states who are in approximately the same place, that will help, certainly help some. Hi, Betsy. Yes, we'd love to have you come down here to New Jersey as soon as it's safe and possible. Love to see you. So phase 3, safely reopening, would be a second stage of containment before there is a vaccine. that vaccine is at least 12 to 18 months away, even though they are starting trials or have started trials. By the time they figure out the safety, the efficacy, uh, it's going to be at least 12 to 18 months away. So we need to get reopened, get back to business before we have a vaccine. So the second stage of containment, restarting our economy and doing it safely. What we need is greatly expanded lab testing. Many labs are working on this diligently. There are emergency waivers being put in place by the Food and Drug Administration to get testing out there. We need both the virus testing and the antibody testing to see who's been exposed to the virus so we can get a much better view of what's happening in our communities. Without the lab testing, we're still blind to what's happening in the community. Once we flatten the curve and are past its peak, cases are decreasing, then we'll be in a better position to use the standard public health measures more effectively once again. With the capacity to test, we can target new infections, to isolate those new infections and do contact tracing and isolate them. This takes resources to be committed to this, as they did in South Korea. We will still have to maintain our personal hygiene, our good hand washing and sanitizing, our cough etiquette, more disinfection in public places, and possibly masks in public places, as we see in some of the Asian countries. Korea, Taiwan, Hong Kong, Singapore, and China are in this phase now. People are returning to work with face masks and gloves. But their schools are reopening, people are eating in restaurants again, and the populations are resuming a form of normal life. I don't think for the foreseeable future it's going to go back to exactly the way it was before, but at least people are getting to eat out again and to socialize again. So I think I'm looking forward to this next phase. Um, as I mentioned, we may still need to wear masks in close quarters in public places. Uh, might have to wear masks. People who are going onto public transportation. You go into the supermarket, you may want to wear a mask. When you come into a lot of contact with people indoors, probably going to need masks. Outdoors, not quite so critical unless you're going to be in a crowded outdoor space. But we'll have to see how we're going to do with all that. So Betsy mentions in upstate New York and that there are many people wearing masks up there. Um, you know, I I personally feel that masks are important. I know that there was some confusion in the beginning. The public health experts were going based on previous epidemics that were not quite as transmissible as this has been, Betsy. So um, they couldn't show the benefits of masks in those cases. But with the increased transmissibility, and even though we don't have all the evidence yet, I think most experts have tilted in favor of people wearing masks for two reasons. Number one, it lets you put out less droplets into the environment, therefore decreasing transmissibility. And number two, if you get a droplet on your hands, it makes it harder for you to put it in you know, by your nose or by your mouth or inside either one of those places. So, therefore it decreases transmission that way. So, you know, my personal belief is that people should be wearing masks when they're going out and coming into contact with other people. I think people belatedly, when the coronavirus starts really going in their community, I think a lot more people start wearing masks. Um, Down here now, they're mandated in in the supermarkets and that kind of thing. But yeah, the more there is, the more danger people and risk people perceive, the more they are more likely to wear masks. But for their community, it would be best if they wore the mask before it really got going, because there are cases in the community, and you know this spreads exponentially. So if people are not taking appropriate measures, then one person can affect two other people, and there's that exponential spread. Um, so guess that's enough said about the mask issue. Phase three, this phase is not managed as well as we reopen. We could actually drop back into phase one, um, where we have to start doing containment again before we can and mitigate in phase two. And this will prolong the disruption to our lives and economy. Also, before lifting restrictions, we should make sure our hospital workers are protected. I'm going to make a personal plea here, having worked in the front lines in the ER for 24 years and knowing what that is like. This touches all of us. We all have friends, coworkers, and family on the front lines. We are worried about their personal safety. And if they get sick and the health system is decimated, who will care for us? So let's put on and keep up the lobbying pressure to get personal protective equipment for all our healthcare workers, for their sake as well as for our own. This phase is deemed to continue until a vaccine is developed. And then phase four, this is another stage of containment once we have a vaccine. Thoughts are it could even turn into almost like a seasonal flu situation. We just don't have enough information about this yet. Will we really be able to stamp this out, or will it become just another viral strain in the community? But with our new standards for personal hygiene, we should be in a better place. By the time a vaccine is developed, we will have a much better idea about its actual rate in the population, the actual rate of the virus in the population, and its actual death rate as more data becomes available. And then phase five is thoughtful preparation for the next pandemic, potential pandemic. Now, this is to take lessons observed and make them lessons learned. So we have observed previous pandemics, and there have been lessons that have been observed from them, but we really haven't translated that into lessons learned to really try to get ahead of the next pandemic. Um, to perhaps take the potential pandemics like we had with SARS or Ebola and snuff it out before it can really get going. This will mean significant international cooperation, but we've done it before with those two cases that I mentioned, and we can do it again. So that's the end of my formal presentation. Know if there are any more questions, comments. Certainly if you're seeing the recording of this, please feel free to personally message me or put it in the comments. Try to keep checking that. And for those who are interested, I am going to post a fundraiser for hashtag Meals and Masks to frontline New York City and New Jersey hospital workers. It's called the Hospitality, HOSPITAL-ITY program, supporting both hospitals and the restaurant industries. This group is providing meals to frontline workers. They're, I believe, a group of restaurants, and so they're supporting both the restaurant and the hospitals. So I will post that, and tomorrow I'll share how I learned of that. And if people have other fundraisers that can help our hospitals in the area, I'm certainly willing to highlight that and to feature them also. Want to help our frontline hospital workers as much as we can. Okay. Hi, Nancy. Yes, we're just wrapping up here. So, but you'll be able to see the recording. Um, and let me know if you have any questions. Okay. Thank you for everyone who participated. And I will be back here on Sunday at 9 o'clock a.m. Okay. Everyone take care. Have a good rest of the week. And I will talk to you soon. Okay. Bye bye.